Critical elements of Los Angeles County's HIV and STI prevention infrastructure are at risk of being eliminated. This includes some that have been serving our communities for over 20 years. This will be devastating for our residents. We have begun to see progress after years of exponential increases in chlamydia, gonorrhea, and syphilis rates. Defunding could set us back and worsen inequities. The Los Angeles County Department of Public Health anticipates annual HIV diagnoses could climb by over 40%. Most importantly, there are real people behind the numbers, people who will have less services and resources available to support them and their health. Let's learn more about Essential Access Health programs and how we support our local HIV and STI prevention efforts.
Our Expedited Partner Therapy Program, or EPT, reduces barriers to treatment by providing free medications for the partners of patients who test positive for STIs. This is a safe and effective treatment option for people who face difficulties coming into the clinic for testing and care. It ensures that partners receive convenient treatment as soon as possible. Without the EPT program, patients may lose access to this crucial option for partner treatment, as many health centers do not have the resources to purchase and distribute partner medications. This will cause delays in urgent access to treatment for partners, disproportionately impacting people of color and adolescents, which are two communities who often face the most barriers to care.
In the last 2 years, we've distributed over 100,000 resources to help support our partners and our communities. These cuts will lead to less resources, such as clinical tools for doctors and safer sex supplies for patients.
Syphilis can cause life-threatening damage to our bodies and dangerous complications to pregnancies. We partner with community-based organizations who are already working with populations highly impacted by syphilis, and we train their staff to talk with clients about their sexual and reproductive health care holistically, from STI prevention to birth control to prenatal care. We also connect them with quality clinics from our contacts so that staff know exactly where they can refer their clients for care.
Health centers in LA County are often overwhelmed with the amount of patients they see and services they provide. Essential Access supports health centers through trainings, coaching calls, and technical assistance to improve sexual health services and increasing STI testing. Clinic staff, such as doctors, medical assistants, and health educators, learn best practices when it comes to patient centered care and normalizing sexual health access. Eliminating support like technical assistance and training for clinics will result in fewer quality initiatives and less access to support for implementing high quality care. This will impact the health outcomes of patients at a time when we have just started to turn the tide on rising STI rates.
Public awareness campaigns are one way in which we help bring critical health information to the public and meet people where they're at. Through billboards, bus ads, dating apps, and social media, these campaigns get health information to individuals who may not be accessing healthcare regularly or may not be aware of relevant sexual health issues. With cuts to these programs, more people will be left in the dark about STI concerns in their community and will have less agency to make informed decisions about their own health.
Through our collective HIV and STI prevention efforts in LA County, we have made hard-won progress in reducing rates of infection and increasing quality of care and life for our communities. The federal cuts will undo decades of work. People will lose access to critical services, and there will be more misdiagnoses and higher rates of infection, all while clinics and community organizations have less and less resources available to help support their patients.
As one of our partner organizations, Eggleston Youth Center's Substance Abuse and Education Programs has put it, these programs save lives, and losing them would be a tragic step backward for our community. We urge decision makers to protect and continue funding the vital work of Essential Access Health. The health, education, and futures of our communities depends on it.
This is why we are urging lawmakers to commit $60 million in the upcoming budget to cover cuts to prevention programs. The funding could be reallocated from revenue generated from the AIDS Drug Assistance Program, which has generated more than $1 billion that California could use for this purpose. We are also calling on our local and state leaders to step in to fill STI prevention funding gaps. It is vital that the California government affirms our commitment to the health of its people and leverages resources to protect our communities.